gift is to help, and nothing is too small, nothing is too big. And I've never suffered from a lack of empathy, and I try my best to always look at situations and put myself in that person's situation and say, what if it was me? A lot of people can ask for help when they need help, but when you're in a position to give help, would you give the help that you need? And I always ask myself that question, and I I really try to reconcile with that and make sure that I'm consistent, that I have integrity, that I have empathy, and I don't ever want to question um, helping somebody, because I know if I needed it, I would want to be the person that would help me.
Welcome to Kidney Health Interview. This is a place to get inspired and moved by renal warrior stories. Hello everyone and welcome to Kidney Health Interview. I'm so thrilled to invite Shawna Robinson to share her journey, deciding to become organ donor and actually stepping in and saving life of amazing person, and being very open to share her experience and share her journey, deciding to step in and being that person for someone. I think it's just the most incredible things that any of us can do. So I'm so thrilled and so grateful to invite Shawna to today's conversation. Hi, Shawna, and thank you so much for joining. So great to have you here.
Thank you so much for having me. I'm really happy to be here and to share.
Shawna, could you introduce yourself? Where are you based? What do you do? What made you decide at some point in your life to become organ donor?
I am from Los Angeles. Again, my name is Shawna Robinson. I am currently working as a medical coder. I am a civilian on a Navy base in Japan. I've been here since the end of January. And about my organ donation journey, I was always curious about organ donation, and it was something that I was interested in. I started off donating blood and platelets in high school, and I've always been interested in what I could donate as far as trying to help people in blood donation in high school. And then after that, I was looking for volunteer opportunities, different jobs and volunteer opportunities earlier. And I saw an ad for, and so I did my research on that and get swabbed so I could be in a bone. And then further on down the line, I knew kidney donation, but I just didn't have the education in order to go forth with it. Later on down the line, my best friend told me her brother Marc was going through kidney failure. And as soon as they told me that he got listed and that he would need a transplant, my immediate text back to her was that I wanted to get tested and that I was interested in being the donor. So that was my thrust into kidney donation education, was going through that process.
You've been always motivated and encouraged to help humanity in any ways you can. And then going through all this journey, finding out the opportunities where you can get involved, you came all the way to kidney disease. So I'm so happy that today we can explore a little bit more that journey of organ donor and that internal need to be part of the change that sometimes we want to see in the world. Yes. Go back in those years when you initially started volunteering and looking to participate in any ways to donate blood or volunteer in a community. How did you receive education and how you receive awareness about those needs?
So it's a couple things. So my grandmother was a medical transcriptionist. So I grew up in a hospital. So I grew up being in a hospital setting a lot. And so that gave me a little bit a taste of the medical field. And then in high school, we used to have blood fairs. The Red Cross used to come to our school and they would ask for volunteers to donate blood. And then in high school, I worked in a program called the YED program. It was through my high school called Fairfax High School. And it allowed, I was Cedar Sinai, so it allowed high school students job training. I initially worked in human resources, and my mentor was a nurse recruiter. And it was at that time, being under her, I decided I was interested in becoming a nurse. And so it was through working with a hospital that after I started donating from the Red Cross in high school, I started donating directly to the hospital, donating blood. And then through there, I learned about donating platelets. After graduating high school, I continued to work at Cedar Sinai for 5 years. And then I eventually went to a clinical area, ER, and that's where I learned a lot about different donating modalities, as far as donating blood, donating plasma, but not really getting the full education then, and then bone marrow. So growing up, I had the medical background with my grandmother, and then I've worked in a hospital since I was 16. So healthcare is all I really know.
With the influence of your grandmother and your surrounding, you selected your career and helping in both fronts. On one side, dedicating your career and life to this as your calling, but on the other side, actively participating in a personal matter.
I do want to clear one thing up. I didn't end up becoming a nurse. I am still in the medical field. I'm a medical coder now. So I decided that I didn't want to be on the clinical side. I wanted to be on the administrative side in the background, but I still ended up in healthcare. I found my way.
Well, I'm sure there are a lot of things that you can really support the healthcare, especially in these times, where the administrative and management and coordination aspects are so crucial for the global healthcare. I'm really curious in terms of numbers. Do you know how many blood donation you've done, or how many lives you were able to impact starting so early in your life with blood donation?
No, I actually don't know how many blood donations I've done. Um, but I do remember that 2007 I became pescatarian. Pescatarian is when seafood is the only meat that you eat. After that, I became anemic. My iron levels dropped. And so your iron has to be at a certain level in order for you to donate blood or platelets. So not long after, I wasn't able to donate blood or platelets anymore. And that actually affected when I was able to donate my kidney to Marc along down the line.
This certainly goes through very rigorous assessment, and very often
Yes.
people do not get qualified. So actually, it takes a lot for someone to be qualified to be organ donor, versus, I suppose, in a blood donation, things a bit easier, but the lab work is the most important part.
When you donate blood, you literally go in, they prick your finger, in 5 minutes, they can tell you whether or not you have sufficient iron in order to donate. Whereas donating a kidney, you have probably more than 10 visits in order to determine whether or not you'll be able to actually donate.
Absolutely right. And in that procedure, way more invasive, and
Yes.
it requires a lot of education, considering that someone who's a great potential organ donor is someone who's already taken a great care of his or her health. So I'm sure that you were really on top of, like, really understanding every aspect. How can kidney donation happen? What would require from your side? How long does it take to recover, and anything else in the long term?
Yeah. I was going to say that was actually really unique about the kidney donation process was Sinai, and I tried to donate. They told me that I had anemia, which I already knew, but I wasn't motivated in order to get rid of it because I didn't feel the effects in my daily life until, I wanted to donate to Marc. And so it wasn't until I wanted to donate that I wanted to get my anemia in check because I wasn't feeling anything. And so I was trying to take over-the-counter iron pills, but they were making me sick. And I was just so deflated and defeated that in order to help him, it was at that time that I actually switched primary care doctors. And the doctor did my blood work. She told me I was anemic. That I already knew. But and my iron infusions could get my iron back up, and they didn't have the same effects that the over-the-counter iron pills would give me. And so it was at that time that I did 2 about 3-hour iron infusions, and I didn't have anemia anymore. My iron levels were at a sufficient point to where technically I didn't have anemia. And then by that time, Marc was relisted at UCLA. I was a match, and the rest was history.
That's so great. You were able to set up those priorities, take care of your health first of all, and get everything in check, whether certainly with motivation to save someone's life, but also making sure you're in the best health to go through this procedure. Aspect of at some point when you woke up one day and decided, I want to make a donation to someone to save their life, whether it's a bone marrow or something else. What was something that you felt enlightened to those?
I feel like my gift is to help, and nothing is too small, nothing is too big. And I've never suffered from a lack of empathy, and I try my best to always look at situations and put myself in that person's situation and say, what if it was me? A lot of people can ask for help when they need help, but when you're in a position to give help, would you give the help that you need? And I always ask myself that question, and I really try to reconcile with that and make sure that I'm consistent, that I have integrity, that I have empathy, and I don't ever want to question helping somebody, because I know if I needed it, I would want to be the person that would help me. So that's how I live my life. It isn't for everybody, but that's what works best for me.
Speaking with organ donors and people who step in saving other people's lives, it's always come with that willingness to give and willingness to provide, and it's very selfless. And it's incredible to meet people like you. It's really inspiring. And I know that there are a great amount of people who considering stepping in and become organ donor, but sometimes they may be just not sure about the process, or maybe even not sure what questions to ask to fully understand what to expect. What would be your advice? Where to find resources? How to think about this?
So what I didn't know at the time that I donated was that I could ask to speak to somebody that had donated before. I don't know if all kidney programs offer this, but that was a resource that I had. I felt like I had already decided before I even got my blood tested and found out I was a match. However, if somebody is on the fence, I feel like that is an amazing resource for them. I feel like social media is an amazing resource for them. After I donated, I actually went online and found videos of people that have donated and have shared their stories. That's a resource I had beforehand that I didn't realize. I didn't think to look, because again, I had already decided, but there are lots of different resources for people that are on the fence about this that could get more details from people that have experienced. I feel like there's a big difference, and I give a lot of props to the people that work in the field, but there's a big difference between having intellectual knowledge and experience and empirical knowledge and experience. And hats off to the nurses and the doctors that work in the field, but I feel like there needs to be more platforms like the one that you have, in order for people like me to speak on them and let people know exactly what did that pain feel like? What do your scars look like? How long will you be away from work? Just all of that really important information in order to inform people to make the best decisions for themselves and their families, because this is something that will affect your family, because more than likely they'll be taking care of you when you recover. So this was initially something that I wanted to keep to myself, but I ended up sharing with people. And I'm thankful that I shared because those people ended up taking care of me during my recovery.
In your personal journey, when you have decided and have received green light with the labs and medical teams that you can donate, what was the next step?
Oh, I was so happy and excited. There were numerous steps because I was actually in the middle of, I got a job offer to actually come to Japan. I was, at the time, I was working for UCLA. I was working for the hospital that I donated at, ironically. And I was, I got a job offer to come to Japan, and the kidney team knew this, and I was egging them on, like, can we speed up this process? Because in my head, in my heart, I knew that Marc was a priority. But if there was any chance that I could do both, that I could both donate and come to this job, I wanted to make it happen. And so I actually did a lot of reassuring with Marc's sister, who's my best friend. She knew about the job offer. She knew when I was going through backgrounds. And I told her, I will not come to Japan if they don't schedule me in time for surgery, because the job offer here, they wanted me to be here at a certain time. And so it was interesting. Initially, they wanted me to come the Monday before Thanksgiving. And I told them no. And I asked them, could they push it back? And they pushed it back until the end of January. And then once I got the call that I would be able to donate, I asked them, could we make it as soon as possible? And they said, well, usually we don't schedule the surgeries out until 6 to 8 weeks, but because you have a special circumstance, we can do it in 2 to 3. Because after surgery, the doctor doesn't give you an all clear to exercise until 6 weeks after surgery. So I wanted to make sure that I had recovered for 6 weeks before I came to Japan. So literally, we did it by the skin of our teeth. We scheduled surgery December 10th, and I left for Japan January 23rd or 24th. And literally, whatever day that was, I left on the 6-week mark and just made it. So I was very thankful to the team. I was very thankful to Marc. I heard Marc's podcast, and he was like, when he got told the date, he was like, wow, that's quick. And I'm like, well, yeah. I told him, we had conversations, and I said, I need you to be ready. I need you to be taking your medication. I need you to be compliant, because I want to show up for you. And I also want to knock out this dream of mine. If I need to delay it, I will. But I need you to be on top of everything so you are 100% ready, because I'm ready. I've been ready.
Shawna, it's
It's just been the
incredible. This is
process that has
incredible.
taken so long.
Yeah, I just never heard anything like
Yeah,
this.
it's
That organ
amazing. I'm so
donor,
thankful.
having those two opportunities come to your life and you were able to make them possible. You set up your priority and how things just worked out perfectly.
And the team supported me. They didn't have to, schedule me earlier. They didn't have to do that, and they did that for me. And Marc did too. Marc did everything he was supposed to do in order to be ready for surgery. And a lot of patients aren't ready for surgery because they aren't taking care of themselves. So Marc showed up for himself, and I got to show up for him too, because he put in the work. So I'm very thankful.
I remember speaking with Marc and learning that his surgery is supposed to happen just in a few days. And that was like all between Thanksgiving and Christmas. And it was like
Yes.
magical spirit of holidays and magic and fairy tale. He was so grateful. Of course, he's beyond grateful for this opportunity. Wondering in terms of connection with the organ recipient and organ donor, in how does it feel to connect with someone that you can impact each other's life in such a great sense and level forever? Like, how does it feel? What kind of emotions, what sensations you had?
Well, it's really incredible because before this, Marc and I didn't have a relationship. We had a connection through his sister. I was always at family gatherings, Christmas, Thanksgiving, birthdays, and this was since high school. And it was always just hi bye. And so it was interesting because while I was going through the donation process, Marc's sister pulled me aside and was like, Marc wants to talk to you. And I was like, what? Like, I never considered anything that he may have to say to me. It was just always, I wanted to help. Like, I didn't need a conversation, but he needed that. And I wanted to give him what he needed, but I didn't need a conversation. This is just something I would talk and figure out what my motivations were and even who I was. I didn't need to know who he was. I just knew that he was somebody that needed something that I could help him with. And I don't mean to dumb it down or simplify what happened between him and I, but that's literally in my mind how I think about it. If I can help, I want to help. And so we had a conversation and he asked me, you know, what were my motivations? Why was I doing this? And it was always, but why? But why? And it's just like, I literally want to help. And I'm so thankful that he allowed me to do this for him. A lot of people are scared of surgery. A lot of people are scared of help because of the vulnerable position that it puts them in. And I told him, like, look, once I give you this kidney, it's yours. I'm not worried about how you take care of yourself, what your life looks like. You don't owe me anything. It's not mine anymore. This is yours. This is your life. However you live it is what you decide. You know, your opportunities are your own. And I appreciate him because he continues to use his platform to help other people that still need transplants. And he has made me a part of his journey where I get to do opportunities like this. I mentioned to you before, like, I'm really private, and this has caused me to kind of break down the wall within myself in order to share with people, because I didn't realize I still had an opportunity to continue to help people. Like, kidney donation wasn't the end of it. And initially I told Marc, we had a really long conversation. I was like, you know, I'm really private. Like, I don't want anybody to know, like, other than your immediate family, other than our immediate friends. And after I donated, the first time I saw him in the hospital and all his family was in the room, I realized, like, I can't ask him to keep this quiet. That's so selfish of me. And when he's talking about his kidney journey and how he got to where he was, I can't ask him to edit my part out. Like, our stories connect and and intersect, and our lives intersect in such a powerful way. I can't ask him to edit himself. He's such a powerful speaker. He's such a powerful orator. He's such a powerful force. I can't edit any of that because he would be shortchanging the people that he'd be sharing with. And so that's allowed me to share and speak with people. And I feel very, very grateful that I'm able to do this with him and be a part of his life this way. And it's not hi bye anymore.
That brought this very unique future for both of you, finding out
Yes.
for him the way how to strengthen his health and do so many things he was not capable doing, being on dialysis. And on another
Yes.
side, use this another gift to impacting people in the way what you've done.
When you help other people, you help yourself. And when I was going through this process, I didn't realize how this whole process was going to help me. And I was only ever concerned about trying to help him and then moving on with my life, going to my job. But now I am able to speak on behalf of my experience and those that have experienced the same thing that I have. And I think it's really incredible. And I'm very thankful.
I'm so grateful to meet Marc and now meeting you and learning about your story and the way how powerful this experience was for both of you.
Yeah, absolutely.
With the platform that you and Marc are collaborating and building more awareness, where do you see the next steps, the next opportunities and programs that could impact organ donation and how to build more awareness for the organ donors or people who might be considering?
I've actually participated in another interview with Marc on an app on a phone that connects people with potential kidney donors. And I think that's revolutionary. A lot of times people need to hear other people's stories in order to feel motivated, in order to donate. I myself would like to be more involved in what Marc is doing, and that's something that I've conveyed to him. My only concern is because I am here, I don't know how much I'm able to do. And so that's something that I'm researching myself, because I do want to help more within the kidney donor space. And I feel like I have something, a great experience to offer to this space. And that's something that I would like to get more involved in the future. Even though I just moved here in January, I'm still wrapping my head around the language and the culture. And that's been taking up the majority of my time. But I definitely would like to make an effort to make more time in order to do things like this, in order to advocate for kidney donation.
This is wonderful. I have one final question. I have one more final question since we're running out of time. But as you mentioned that the surgery happened very fast, and then you have to move to another country, to another culture, to the new job. How was your recovery process, and what lessons learned you have from that surgery, moving on with your life, and just adjusting to this new normal set of living in a different world?
Sure. So we had the surgery December 10th. December 11th, I was discharged from the hospital, and I took off work for 2 weeks. Everyone's recovery is different. I could have taken more time off, but I felt well enough in order to return to work. And my job isn't a strenuous job. I'm behind a computer. I was working from home, so I was comfortable. My mother was my caretaker, and she helped me a great deal. I was discharged with prescription painkillers, but they also encouraged me to take over-the-counter painkillers. I never took the prescription painkillers. I only ever took the over-the-counter painkillers. And what I learned during recovery is that you should not watch comedies after you have surgery, because when you're laughing, you might bust a stitch. So I had a lot of free time on my hands, and my mom and I were trying to watch The Office, and I was just like, I can't watch this show. Like, my stomach hurts. So my stomach was hurting from laughing. It would hurt when I would get up from bed from surgery, but I made sure to walk every day because they encourage that, and try to be active but safe, and just make sure you're not doing anything strenuous. So I made sure I walked every day with my mom in the park. And like I said, I was ready to go and leave out of the country on the day of the 6 weeks later. So I got myself up and moved. I was still in some discomfort, but I was not in pain. And by the 6th week, I had long since stopped taking even the over-the-counter pain medication. So I feel like I healed pretty quickly. I have a healthy diet. I was active beforehand. And I feel like for the majority outside of my anemia, I take care of myself. And so I felt like I had a really smooth, uncomplicated recovery.
One follow-up question, in the terms of long-term impact of the post-surgery and organ donation, have you had any setbacks?
I have had 0 setbacks. And ironically, I love my scars. I know that may be an issue for some people, but I have had 0 health problems. So every 6 months after donating a kidney, I'm not sure if it's for a year or 2 years, I have to get my creatinine done, and I have to get my urine done. So I have to get labs to make sure the kidney that I have is functioning properly. And so I got my 6-month test. My kidney is fine. I feel healthy. I'm happy. And so every 6 months, I'll get my lab work done here. I'll send it to my kidney coordinator in the States. She'll look at it. She'll give me a thumbs up, and then I keep going from there. So that's the extent of my follow-up. So I think for either a year or 2 years, I go every 6 months, and then I believe after that initial mark, I think I go less frequently, and then I get my labs done for 5 years for follow-up, I believe. So yeah, very
Yeah,
simple.
thanks so much. And I think it's just so awesome to find out how organized you are and how diligent you are with all the process, following all the labs and taking care of your health, which always sometimes, very often even concern of the family of organ donors. So thanks so much for being a resource responding to all these questions. On a final note, would you like to share to our audience as kidney patients, organ donors, caregivers, to the words of wisdom, or the words of some kind of enlightenment that you received through the experience becoming organ donor and impacting someone who was facing kidney failure?
Sure. It's really short and sweet. Help people the way you would want to be helped. And I feel like forgive the cliche, but I feel like our world would be kinder. We're in a unique situation going through this pandemic where people are having to be considerate to others in order to survive themselves and in order to help other people survive. You don't want to get your friends sick, you don't want to get your family sick, but if they were sick, you would want to help them. And a lot of people don't extend that kind of help outside of their family. If they were in a situation where they needed a kidney, they would more than likely accept it from anyone. So I would encourage people, help people the way you want to be helped, and help anyone. Don't just help the people closest to you. If you can, if it's for you.
Shawna, such a pleasure to have you, and so grateful for all the knowledge you shared today and inspiration, what moved you to become organ donor. Wishing you a great health, enjoy Japan, and looking forward to connect next time. And should I say konnichiwa?
Yes, konnichiwa. Thank you so much for the opportunity.
Thanks so much for staying with us. And if you liked our channel, make sure to subscribe to us on Facebook, Spotify, and iTunes podcast. Thanks so much.